Hello, my name is Joann McCullagh. I'm the Outpatient Service Manager here at the new Omagh Hospital Primary Care Complex. I want to welcome you all here today as I take you on the patient's journey as we enter the new complex and take you to the outpatient service area. As you can see, this is the main reception area, and patients who have any particular problems in relating to when they enter the building will be all sorted out at this point. We have our supporting services, we have our ordering services, and we have our main receptionist. So patients are always here at hand. As patients enter the building and they have their referral letters, patients who are to be seen at our outpatient service, they will have through their self-check-in. I have the support of my two colleagues, Margaret and Niall, who are both volunteers to our service, who are instrumental in ensuring that our patients arrive at the correct clinics, and they are also checked in appropriately to the appropriate clinic to which they're attending. And now we enter the outpatients area, Block B, which has all the facilities for all of our outpatient services. This is Block B of the Outpatients Department. It is zoned into 4 areas. We have Area A, Area B, Area C and Area D. Within those areas we have medical, surgical, ENT and eyes. Also included in our outpatients facilities is our Women's Health Centre, which is on the 2nd floor. We also have bookable rooms on a bookable service, which is on our SharePoint system. That allows for any specific service to actually book into those rooms at a time of need. Those types of patients will be those that are coming from other specialities throughout other services within Northern Ireland. The Outpatients Department was designed through the DBS model, which was the new modern way of working for services for Northern Ireland. Through the transition of that process, it allowed for new services to be brought on all into one area. Due to cost saving and looking at the efficiency that we could provide services to rural patients in this locality, we had to look at new ways of working, new modern ways of working, new ways of cost saving, and also ensuring that we provided the optimum services for the patients in this area. When the planning was approved and with the architects, what it was decided then was the type of design that this process would take. There was new ways of working, new modern facilities, and with that there was a new ways of working within the outpatients area. In keeping with that, it was decided that this area would be for clinic use. So therefore we had to look at ways of co-locating all of our clinical services for all of our clinicians and all of our non-clinicians, AHPs and other facilities all into the one area. What actually transpired was the transition that would take and the large working programme that would need to take place. Over the years, what happened in 18 months prior to the move here, it was essential that all parties participated in the role of bringing all of the cohesive services together into the one area. And what transpired was the bringing together and gathering of all of that information together into one place to allow for that to happen. I was privileged to take on the role because I was in the best place to allow this to happen. With the support of all of the nursing staff, the clinicianal staff, all of the supporting other services which came in from various areas of Northern Ireland, I then proceeded to take all of that information and put it out on a graft. With that graft, then I was allowed to then transcend all that information onto the types of rooms that was going to be used to allow for the patient's journey to be as cohesive. Let me show you what transcended in the end product. This is the final master plan, which took place as we transcended our move over from the Tyrone County Hospital to the new Omagh Hospital Primary Care Complex. This proceeded with the information gathering over the 18-month period of time, where all of the information was conveyed through meetings, through emails, through face-to-face, through group sessions. All of that information was all collated into a database, which I then proceeded to then present this onto our performance schedule, our capacity plan. As you can see, this capacity plan is 700 sessions with over 70 rooms. The main outpatients area is Block B, and within that has your Monday to Friday sessions all within that. Also within it is your critical care centres, your women's health centres and all of the bookable rooms. What that does is if someone now wish to have an extra clinic, waiting list initiatives, core clinics, or services from another area or another part of Northern Ireland, I can easily and very clearly alert them to where there is gaps in the service to allow for more productivity. I'm very much forefront in providing motivation to allow for more progress in outpatient services, and also what has been the key to allowing this all to happen is that everyone knows the room that they're in, they know the day they're there, they know who they are with and who they're co-located with. The other aspect is due to the fact that we have all the rooms numerical and we know the co-location of those areas, the co-location of services is to ensure the continuity of the patient's care at all times, the collaborative working with all of the specific disciplines together. Also, in keeping with that, all of the telephone numbers are listed and all the PC numbers are listed. So therefore, that there in itself allows for a very cohesive continuity of care to all of the patients that approach here. We have our pre-assessment, which allows a one-stop shop approach from some of our clinics to allow our patients to be seen through their one consultation while they're here at that particular time. It has been a very challenging time to work through this. I'm very privileged to work with all the multidisciplinary team to allow this to happen, and as we move forward we all work together.